morning, everyone, and happy August. Welcome to the Tuesday, August 4th, Washington County Board of Commissioners Work Session. Today, Commissioner Treese is excused. I'm anticipating Commissioner Rogers will join us soon. And we have here in the room Commissioner Dick Scouten and Commissioner Jerry Willey, and I'm Catherine Harrington, Chair. The first item on the agenda is board and leadership communication. Commissioners, anything you'd like to contribute?
Just came back from a week of driving the back roads of California and Oregon, and I'd hardly recommend it as a scenic byway, quiet place. You can easily socially distance. If you go from Lhasa National Park to Lake Tahoe, there's a State Route 89. That's a really takes you through a part of the state. I mean, I lived in California for decades, but never were in those places before. Some old little mountain towns, etc. Some great scenery. We couldn't go to Canada this year. That had been the original plan for a lot of reasons. They're not allowing Americans in Canada, but I certainly would recommend that part of the state. And coming back, we went by way of Klamath Falls and again took back roads back into the Portland area. So enjoyed my week off. Don't have too much to report. I do appreciate technology allowing me the opportunity to be at the board meeting last week. I think that was an important meeting. This week, I think, is going to be a much quieter summer kind of agenda. So
isn't it a
that's
nice
good.
break?
That is a nice break, indeed. Yeah, very much so. That's about it. Nice to be back, actually.
Well, but in addition to attending the board meeting last week while you were on your break, you also covered the weekly meeting with the governor's staff.
I did do that as well. That's right.
COVID. Is there anything that we should be updated on?
No, not really. We haven't really covered anything, at least in the last week or two, that we haven't at some point discussed. They're struggling with school openings. I guess that's the big piece at the moment. Multnomah County is now on a watch list, and we're not at the moment, but we'll see how this all plays out. It's really important for all of us to continue to mask and socially distance. I'm having my coffee right now, otherwise I'll get the mask on momentarily. Also, I just noted that I did attend yesterday a tour of the
Sleep Village.
The camp for
the Safe Sleep Village.
Yeah,
yes.
And we're providing an option for folks, and I appreciate Hillsborough's cooperation. And it's going to be a safe place, and perhaps people will be able to take advantage of that. And we're doing what we can to keep people safe, not only from COVID, but also from the elements and from the vagaries of homeless living. So,
yeah. The COVID case numbers certainly complicate the academic school year starting off, and Marnie's going to help us better understand the Ready Schools, Safe Schools model in a bit. So, Commissioner Willey, anything you'd like to add?
Yeah, I also went to the Safe Sleep Village yesterday after you had just, I think, both left. But anyway, it's very cool, nicely laid out, and what a great plan, what a great use of the Cloverleaf building. So that's a perfect setup. So it was good. I've been working a lot on the PPE logistics, primarily with Diane, and certainly Diane will bring us all up to speed, but I really appreciate your work on it. She's been doing a lot of study and homework, and is now providing PPE that we cannot get from other sources for free. We are now working with Diane to make sure that we all get that and get that to the BRCs. We're looking forward to our first shipment. Well, some of it was delivered by Bruce Earl on Friday, and that was really, really nice for Bruce. Shout out to Bruce. Thank you for helping us out with the BRCs, and then when we get our first big shipment here in a couple weeks. So that's been a real fun and exhaustive, long adventure, and so we're not through with that by any means, but it is a good start. Also been working a lot with, again, with my Salmonberry Trail folks, both the agency and the foundation, and have asked the government relations team to weigh in on a couple specific federal programs where we might be able to get some money for the trail, as well as state and local. So the GR team and I are going to be meeting to talk about that probably sometime this week or next week. I can't remember if that's been scheduled or not. But anyway, we've been working on that. That's been fun. It's quite frankly, it's a good diversion from the COVID-19 stuff we've been dealing with for a long, long time. So it's fun to talk about something else. And then lastly is I'd like to recommend that we work with Michelle Rios to give an exit interview with Steve Rhodes before his departure, just to give him an opportunity to kind of give us all, I think in one fell swoop, a snapshot of how he sees the county going and his perspective of the job for the last 8 months. And so that's going to be my ask. I don't know how we go about necessarily doing that, but I'm recommending that we have Michelle Rios provide an exit interview. And Steve, I talked to Steve about this yesterday. Steve, if you want to weigh in on what your thoughts are on that, that's fine too.
Well, you can also give it some thought.
Yes.
Get back to us.
Yes. I think it would be worthwhile to try to do.
On the Salmonberry Trail, it's a really unique and exciting opportunity for Oregon, and I think one that we didn't have with the Springwater Trail, given the extent of connection from the Portland metropolitan area, Banks-Vernonia Trail, Salmonberry Trail, all the way to the coast. And leverages all that the state has learned. I know that Dick is familiar with as well, the economic impact studies that have been done on tourism and bicycling here in the state of Oregon. So not only will the Salmonberry Trail provide great recreational opportunities for those of us who live in this state or in this area, but also for drawing additional visitors to our state and contributing to our tourist economy. So after having worked on federal funding opportunities for the outdoors and making sure that trails can get more federal funding written into bills and policy, it's nice to finally have such an impactful project that can seek those opportunities, just as other states in our country have done with rail to trail conversions.
Yeah.
So keep up the good work.
That reminds me, actually, thank you, Madam Chair. I have still buried, sort of before the internet really took over everything, I still have a hard copy of an economic report that was done back in 2004. It was a joint project with the University of Montana and University of Pacific. Apparently at the University of Montana they have a specialty, or have had in the past, of melding outdoor recreational stuff with economic development, and they have people in the business school there to do that. But the report obviously needs a serious update, and it focused in on 3 northwest counties in the corner of the Tillamook, Clatsop, and our county. And maybe I can dig that up, give it to you at some point, and maybe at some point we can get some kind of an update on that analysis. It's obviously neat. It's what 15 years old at this point, but it was a very extensive report on how trails and other things could really be a positive and are a positive for the northwest corner of the state, particularly the rural part of it.
Yeah, that would be good to see. It's interesting how long the planning part and the getting the wheels turning takes on this thing. And this trail may not be completed for 20 years, but we are starting kind of in a baby step mode. Obviously, Tillamook County is considerably ahead of us. The seaside communities, well, the communities at the ocean such as Rockaway and Garibaldi are all on board, and they're chaffing at the bit to say, we need to get some pieces done on this. And so it's it's really a fun project. We're gonna, obviously, our trailhead starts at Banks, where the Banks-Vernonia Trail is, and so those are gonna blend together for a few miles, but there's some enhancements that we need to do there because there's just not enough parking. So lots of stuff to do and things that I think we can get done in the next few years. So looking forward to that.
Yeah, yeah. I don't know if the Travel Oregon folks, when they did their study on the outdoors and bicycling impact statement here in the state, if they had access to that study or not, so.
Yeah. The study I'm referring to very much focused on our area rather than statewide.
Yeah.
Type of thing, yeah.
Yep, that's great. Thanks for that contribution. Commissioner Rogers, good morning.
Good morning. Late night, last night, had ODOT Region 1 meeting, about 80-some participants. Always fun to manage a virtual meeting. As you know, I chair that. We talked a bit about the 24, 27. That's really hard to get my mind around. 24, 27 step way out there, but I guess that's always the way it is. And tolling on 205. And so it was always eventful.
Yeah.
A lot of people.
That 205 tolling topic will be coming here in the next
Yeah, it's
couple of
interesting.
weeks.
A lot of questions. They're bringing back some analysis. So, yeah.
Great, great. I've really been focusing my time over the last week or so on COVID work and also topics that will be coming before us in the next couple of weeks in work session. I did send all of you a urgent letter that the 3 county chairs worked on to the governor. That's in your inbox with regard to asking for additional resources, particularly with Multnomah County on the watch list, and just the large community case numbers that we have here, and needing to ensure that our community has the support that they need, but also that it's pretty clear that personal responsibility is really what affects the behavior of those numbers in the curve. So, about it. So, leadership communication. Why don't we start on clean water services first for a change?
Good morning. I wanted to update you a little bit on the people protecting people, so getting PPE out to the community. I really want to thank Stephen Rhodes and Jack Liang and Will Carver and also John Wheeler over at the EOC. We were able to coordinate with them, and we're pushing out 170,000 KN95 masks and also 5,000 bottles of hand sanitizer out to folks, and we're augmenting that with PPE that folks need, ear loop masks and cloth masks that Commissioner Willie talked about. But both Commissioner Roy Rogers and Jerry Willie really helped us put this together, and we're very appreciative of that. So it's really Bruce Roll, who's very creative. He's getting PPE out to the ag community, to the food banks, working also with the Visitors Association with Carolyn McCormick and also with Deanna Palm to make sure the BRCs are properly resourced, and also Mark Jockers. All of this happens because it's a community of people, and we're really appreciative of the county and our partners in the community to get PPE out to folks. So thank you to everybody. Mark Jockers has a privy council on our 2020 LEAF program. So that's part of the business that's going to happen in the fall. So we wanted to update you on that.
Thank you very much. I wanted to call your attention to the Privy Council. Later this week, we'll be sending a letter to the about 10,000 customers that over the last 25 plus years have gotten curbside leaf pickup program. As you recall, over the last probably year and a half, you charged CWAC with looking at how we might continue that program in a way that's sustainable and equitable. The challenge we had is the curbside leaf pickup program only provides service to about 15% of our customers, so about 85% availed themselves of the drop-off program. What CWAC recommended and what the board concurred with was to eliminate the curbside drop-off program and pretty dramatically expand the drop-off program. Right now, up until last year, we did about 4 drop-offs a year. This year, we're looking at doing 18. So pretty dramatically different. Nonetheless, I think this will be a challenge for those 10,000 customers. We're getting out to them now to tell them about both the expanded drop-off program as well as other alternatives such as, getting another leaf bin. The challenge we had is the program was originally for street trees. Over the last 25 years, it almost became a landscaping service where people would take all the leaves from their front yard and their backyard, their neighbor's yard, and everything else and put them out front. So, which was, I think was probably very easy and convenient, but didn't really meet the purpose of the program. We'll also have another piece that will go out at the beginning of September to all of our customers to talk about the expanded drop-off program. These primarily are in Commissioner Scouten and Commissioner Treese's districts. So you may get calls on that. Certainly, we'd be happy to take any of those calls as well.
Over the years, we've taken calls from certain individuals that were sort of like the fall was very much an annual event.
Yes, they were very regular. So thank you.
Mark, I had one
Yes.
question. On your wording, it says beginning this fall. I thought that was eliminated last year.
The recommendation was made last year, but the way we decided to do it is phase it in. So last year, we said, this is the last year. Get ready for next year, which I'm sure that a lot of things have happened between last fall and now. So I wouldn't be surprised if people are a little surprised by it. Okay, thank you.
Great, thank you.
Thank you.
RKO.
Just a couple of items. At the suggestion of the chair, we will start supplying the rolling calendars to all commissioners once a month. What we're going to do is supply it the beginning of the month, right after our first rolling calendar meeting. We meet on Wednesdays, so that means Thursdays after that meeting each month, we will supply that to the board in hard copy. If you would like it electronically, let us know and we will submit that to you. But most of us find it actually easier to use in hard copy, but we'll supply either way. The other thing is just, again, to remind you, we have the CEIO interviews this Thursday and Friday. On Thursday, we have 2 panels, a staff panel and a community panel that will be meeting with each of the candidates. We have 3 candidates coming. And then they will provide their feedback to the final panel, which will meet on Friday. And there are 5 members on that final panel. There's the chair, Commissioner Willie, the sheriff, Tanya Angie, and Eva Labonte. And so really looking forward to those. And hopefully by late Friday, we will have a person in negotiations for that position. That's it. Thank you.
Nothing to report here.
I just want to remind us that there is a special session of the legislature next week, and we received an update from the government relations team yesterday on that. But I thought I'd just check, especially since we have our interim director of government relations in the room, to see if there are any questions anybody has.
No, it's not clear yet if it's just one day or several days or what.
Yeah. Yep, I don't envy the legislators, that's for sure, especially in these COVID times. Okay, are there any questions on today's formal agenda? On the action item, there was an item added from the first published agenda and another item on the consent agenda. Okay, seeing none, we'll move right in to our next topic on the agenda, COVID-19 update with Marnie Kyle. Good morning, Marnie.
Morning. Good morning, Chair Harrington and Board. Got the right one up and everything, thank you. So just really quickly, in this presentation for the work session, I didn't really put numbers in, and I'm almost afraid to say these out loud because they're low, and I don't want to jinx us, so. But since yesterday, we had 13 new cases reported, but 6 new hospitalizations, so that's not a good number. So we're up to 2,791 cases and 88 presumptive cases.
Can I ask a quick question?
Sure.
Just because we've gotten some feedback via our constituent communications. And some folks were, when we had Dr. Rep in, was that 2 weeks ago, maybe? In our board meeting, she did a really great job of bringing forward different elements of the data and explaining it. And I recall at that meeting really being impacted by the state of affairs for ICU beds.
Yes.
And I think, as she mentioned, we were essentially a couple of car crashes away from having a shortage of ICU beds for COVID cases. And I think part of what I've come to appreciate in digging into that a little bit more is that the hospitals have been able to get back to more normal operations with different kinds of surgeries and so forth. So generally, they run at about 80 to 85% efficiency of those ICU beds. And then here we have this great unknown, right, of COVID. And so hearing that there are 6 new hospitalizations in just one day, and also over these last 5 months, one thing that I've come to be more familiar with this new virus is that there's a reason why people are in the ICUs. It really impacts your lungs and the other organs in your body. So that's something that I'm not sure that our viewers had the opportunity to really get familiar with in the first presentation of that information. So that's my sharing of information with regard to hospitalizations and ICU beds. Is there anything that you would like to help all of us, the greater community, better understand about the experience that we're having with ICU beds here in Washington County? And as she and you well know, that we're also connected in a region. So while we may experience maximum capacity here in Washington County, we do have our other tri-county hospitals to help us through.
Right, thank you, Chair Harrington. So last week I did share the ICU bed update, and we were at about 85%, which is pretty normal for the hospital systems. And I think, as you pointed out, it is a regional system, and so we're still using that system. If there was capacity issues, say in Washington County, that we would be able to access beds in other counties, and really even statewide if we needed to. I didn't bring the numbers today or for the 10 o'clock on ICU beds, but I can start incorporating that in each week as well, just to kind of keep a tab on that.
Well, it's not so much that I need a regular tab, but if there are these inflection points, because as I've come to appreciate, our case numbers really are a reflection of the effectiveness of every community member taking personal responsibility. So if we can see that, particularly with, I mean, when you need an ICU bed, you need an ICU bed, right? It's not like, oh, I just need my teeth cleaned. So if there's a critical time, such as the warning flag she was raising,
Yes.
I think it was very effective.
Yep.
Thank you.
Thank you. Okay, next slide. So just to give you a preview at the 10 o'clock board presentation, I'll review the numbers a little bit more in depth, like we normally do. Talk really briefly about the watch list and a really high-level school reopening review and just our normal community reminders. So that'll be at the 10 o'clock meeting, just to give you a preview. So next slide, please. So at this work session, what I've understood is that you were hoping for a deep dive into school reopening. So I'm going to talk about planning levels and the matrices. I'm going to talk talk about metrics for in-person school services, review some exceptions, and then talk about local public health roles and the support that we've been offering the schools. Excuse me. Okay, next slide. Okay. So July 28th, the governor released the new metrics for school reopening. And as you can see, the statewide metric is that there is test positivity that's equal to or below 5% in the preceding 7 days. And you can see under the purple banner that the statewide testing positivity rate, the 7-day average, yesterday when I did this slide was 5.1%, and it's actually gone up to 6.1%. So the numbers will be published tomorrow. So it's unfortunate we meet on Tuesdays because we get the latest update on Wednesdays. But just so that you know that the statewide average is actually 6.1% now. So, and then there's county-specific metrics. So a case rate that's equal to or below 10 cases per 100,000 population in the preceding 7 days. So for Washington County, that means that we need to have roughly 61 or fewer cases per week to meet that case rate. And then the test positivity rate of 5% or lower for the 7 preceding days. And you can see our status. The other thing is that counties have to be in phase 1 or higher. So we are in phase 1. Our case rate last week was 48.9 per 100,000 for the 7-day period, and we had a test positivity of 4.9. And again, I expect that that's going to go up tomorrow when we see that data. Questions about that? Nope. Okay. So then there are exceptions for in-person learning. In the next slide, I'll show you the data the metrics that have to be met for these exceptions to take place. So there's exceptions for in-class options for K through 3. And the reason is because there's some studies that have shown that that age group has lower rates of infection, they get less sick, and they may spread the virus less than older students or populations. The other thing is that age group really needs that in-person support to help with especially math and reading skills, which this is foundation. I think you probably remember from some of our presentations around school readiness and really to set young people off on a positive life trajectory. They need to be at grade level by 3rd grade in reading and math. It's really foundational time for them. So the other exception is remote and rural school districts. And I could, when I was working on this yesterday, I could hear either Commissioner Rogers or Commissioner Willie saying, well, how do you define rural? So I dug into that, and rural is defined as 8 miles from another school that serves the same school age. So if it's K through 8th grade, it would be another school that's serving that age range within 8 miles, or if it's a high school within 8 miles. That's how they're defining rural school districts, or with 100 students or less. So there's also some exceptions for students with special needs, and that includes technical schools that may need in-person time for certain skill development. And then, children with disabilities or with medical conditions that need in-person care. Questions about that yet? Okay. So here's, for those exceptions to be made, these are the metrics that have to be met first. So one is that there isn't active spreading of COVID-19 in the school or the school district, that the case rate for the county is less than or equal to 30 per 100,000. So it is a slightly higher case rate than opening up all of the schools. And then test positivity is equal to or less than 5%, and the schools need to be fully in compliance with the sections 1 to 3 of the blueprint plan, which you can see is the public health protocols, the cleaning and sanitation protocols, and that they have a plan in place for their outbreak response.
I do have a question on the first bullet.
Okay,
School or is it school district?
it's in the school.
So you could have, I'll pick on Hillsborough because we're sitting here. You've got school buildings that are quite a ways away from the center of Hillsborough. So you could have some schools who might have active spreading and more rural, even though they're the same school district, who would not. They could open.
Correct.
Rural schools.
Yes, yes. So it's, if there is not, and these are, remember, these are for the exceptions.
I understand.
So it's for the K through 3, kids with disabilities. Okay, yes. Yep. Okay, next slide. So health and safety, that's sections 1 through 3 of the operational blueprint. And I kind of keyed in on this because we're not responsible for instruction and learning. The schools know how to do that, thankfully. And so public health will be provided the blueprints, sections 1 to 3, and we have to review and attest that we've reviewed those blueprints for the schools. And part of what the schools are really having to understand is that it's not necessarily a one-way journey. Schools are being required to put plans in place to be able to transition back and forth from comprehensive distance learning to in-person learning. It might be a hybrid model. They might then have to go back into comprehensive distance learning. And they actually have this quote from Dr. Fauci in the Ready Schools Learning Blueprint that you don't make the timeline, the virus makes the timeline. And I think that that's really important for all of us to remember, even as I was looking at these numbers today and thinking, oh, maybe that means we're on the right timeline now, but that virus is pretty sneaky and can pop up again, so we have to be always prepared for that. Okay, next slide. So I know this is a little hard to see. I copied it out of the blueprint plan and couldn't figure out how to make it. I'll have to get some great communications person to help me recreate this so that it's more legible. But really, these are the key practices that are addressed in the blueprint. So the schools have to work with local public health and with their facilities, their school nurses, administrators, and make sure that there's physical distancing protocols and tools in place. So just like they have to put the stickers on the floor or some way to make sure that physical distancing is followed, look at their classroom setup, all of those kind of things. Hand hygiene, that there's access to frequent hand washing. The other thing is that they have to do cohorts. And a cohort is actually defined, and I think it was 24 to 36 students can be in a cohort. But once you're put in that cohort, they are really trying to keep those students together and not mix and mingle those students with other cohorts. And so what they're asking is in older classrooms or in where kids would normally go from their math class and then they go to a social studies class, or I'm probably dating myself, they don't even have those kind of classes anymore. I know they don't do home economics anymore. Anyway, so instead of the kids moving around and mixing and mingling with a bunch of other kids who might have different classes on different schedules, the teachers will move to the cohorts. So that's how that piece will work. But you can imagine, if you're in a school with 2,000 students in a high school where there's different electives and different student needs, how in the world are they going to figure that out? And they're doing it, but that's quite a task. Making sure that they have personal protective equipment available. And they were really clear about not being punitive. So if kids, really encouraging kids to wear a mask, there's a requirement to wear a mask, but not to make it punitive for kids that aren't wearing a mask, but to really use positive reinforcement to get the kids to wear masks and to keep their social distance and all those things. Really, it's reinforcing the positive behavior that we want to see in ways that aren't punitive. So they were really emphasizing that in the plan. Environmental cleaning and disinfection. Also, they have to have plans for isolation and quarantine. They'll be doing wellness checks on students, faculty, visitors, anybody that comes into the school, and they need to have a plan in place that if a kid or anybody, visitor, faculty, anybody gets sick while at school, that they are able to isolate them right away, able to support kids through quarantine if they need to go into quarantine, contact tracing, so they have to keep lists of kids and any visitors, phone numbers, contact information if people go into different classrooms, if there's visitors, all of that. Airflow, ventilation, and then of course they have to have communication plans in place that if there is exposures that they're able to communicate with students, families, the community, with public health, all of that. So
On the airflow ventilation, increasingly we see air conditioning here, but in this region, but in a few months, it'll be
heaters,
October, November. And
right.
so then we have to deal with airflow issues with respect to heating.
Right, and I am not an expert in understanding that, but our environmental health staff understand that better and have provided some guidance. And schools actually have experts in that area of airflow and ventilation.
Yeah, I'm still thinking about, a couple of months back, seeing some of the analysis done in some of the Chinese restaurants in Wuhan or elsewhere where people got infected because of the ventilation system, air conditioning and so forth.
Yeah. Yep. Okay, so the other thing I wanted to just review is authorities and enforcement, because this is important to understand. So local public health, counties, we don't really have authority to close classrooms or schools. There is a lot of emphasis on the importance of collaborating with public health when schools are making these decisions about closing a classroom or a school or certain services. But at the school district, the school district board ultimately has the authority to make those decisions. It's generally delegated to the superintendent. And I would say that was what we saw during the early COVID, is that superintendents were making those decisions. ESD is generally delegated to the ESD superintendent. Public charter schools, it's their boards that ultimately have the authority, but they don't generally delegate that as well. Private schools really vary, and then there's the School for the Deaf, which the Oregon Department of Education ultimately makes that decision. So it's just important to know that the schools really, they're really in charge, and they make decisions about whether they're going to close a school or a district. What we have found in Washington County early on, when we were dealing with this in February and March, is the superintendents and the principals were incredibly cooperative and communicated really well with local public health and listened to our guidance. Any questions? No. Okay. So this is what we've learned about the Washington County schools. You've probably all heard this on the news. But the only school that I could not verify was Banks. But everyone else has communicated clearly that they are going to comprehensive distance learning. You can see basically until the middle of November. Or some of them, Forest Grove and Sherwood Gaston, have said until further notice. And then you can see the proposed school start dates on there. And private schools are really, again, they have to complete sections 1 to 3 of the blueprint. Otherwise, they have more flexibility in the rest of the sections and how they complete that. But they're really varying a lot more than the school districts or the charter schools. Okay, so transition planning. So schools have to have a plan for if they have gone to in-person or hybrid in-person learning, they have to have a plan for returning to distance learning. And I kind of think I should have used yellow, because I think of this as the plan for returning to distance learning is kind of the yellow. So when the data gets to a case rate of equal to or greater than 20 cases per 100,000 and the test positivity creeps back up to 7.5, they have to dust off that plan, and I see it as the way it's described as kind of a yellow warning. You better be ready in case you need to initiate comprehensive distance learning, which maybe instead of purple, I should have said is red, that if the case rate hits 30 or greater, then they have to go back into comprehensive distance learning. Does that make sense?
I have a question, which I've been asked as well. Who sets these standards? I mean, why wouldn't it be 10 cases per 100,000, or why couldn't it be 100? Or the same thing with test positivity. Why couldn't it be 2.5, or why couldn't it be 12.5?
Right.
Where do these things come from?
So the standards are, they were developed collaboratively with Oregon Health Authority, the Department of Education, and the Governor's Office. But what they did is they looked at a lot of international studies. And so if you actually go to the document, there's a table in there, which I didn't share, that shows other countries that were successful in reopening schools and what their case rates were and their test positivity. And so that's what these are based on, is really learning from international, looking at other countries and how they've done.
So a good answer is that they are arbitrary, but based upon science.
Yeah, it's based on the experience of other countries, yes. Yes, and it's early, so the standards could change as we learn more. Yep. Okay, next slide. So just briefly, higher education and childcare. So higher education has to, they're submitting their reopening plans by September 1st for a September 28th start date. And what we're hearing unofficially from our higher education community colleges is that they are all leaning towards distance learning, at least for the beginning of the school year. And then childcare. This has been a real difficulty for our parents and parents that want to return to work. Childcare is still only allowed to enroll 12 students into their settings, and they can only have an attendance of 10 students. And one thing is we are expecting updated guidance on August 14th, so I think we're all really looking forward to see what that says. So they are still, childcare is still prioritizing services for essential workers. Okay, so local public health role, I've hit on this a little bit, but we're required to review sections 1 through 3 of the blueprints. And really what we're required to do is attest that we've reviewed that and provided any feedback or comments. What I would say is that most school districts and charter schools have been working with us as they develop their plans, and so we don't expect to see any concerns about the plans. We have been providing tools and forms for both prevention of COVID-19 as well as outbreak response. We're still holding weekly technical assistance calls, and those technical assistance calls includes people like that are in charge of facilities and cleaning to teachers, administrators, school nurses. And so the level of those calls is really kind of driven by the questions that people are asking as they're developing their plans. And then the other thing is that we are finalizing hiring outbreak strike teams. I've mentioned that we're very concerned that most schools don't continue to hire school nurses anymore. And so we're not seeing that that's going to change. There's no additional funding right now for schools. So we are hiring strike teams with environmental health staff and nurses, so that if there are outbreaks in the schools, that we can activate very quickly and provide the support that they need for case investigation, contact tracing, any cleaning, everything that would go along with an outbreak.
Can I ask a question about cost coverage for that? Is that fitting within the public health estimates for the coronavirus relief funds, or are we going to have to pursue reimbursement from FEMA?
So right now, we feel like we're within the CRF funding.
Okay.
Yep, we're watching it.
Okay.
Yep.
So for a school district like the Tigard-Tualatin School District that spans the multiple counties, the fact that Clackamas County doesn't have that funding means that that's a little bit more risky for that. What effect does that have on Tigard-Tualatin School District then?
I think this is probably where I'm going to show a little bit of my ignorance, because I think that the schools are physically located in Washington County, but there might be students that are pulled from Clackamas County. And so our strike team would be the lead and would go into the school and work with the school. And then just like we do with if we have workplace outbreaks or any other outbreak, if there's people that are identified that live in a different county, we provide that information to that county, and then they do the case interview and contact tracing together with us for that person. Does that make sense? Yeah. Did I get it right, that they're all located in, okay. I thought so, but.
No, that's not correct.
Oh, it's not?
There's an elementary school on Fox Hills that's in Clackamas County.
Oh.
That would be, you know, where the hospital is, Meridian Park Hospital.
Mm-hmm.
Yeah, it's back in the Tualatin School District. That's correct, and it's over in Fox Hills. You're right.
Oh, there you go.
There you got one.
That's why I was cautious in saying, I think. There's always that exception, thank you. Yeah, and we would work with the school district and with Clackamas County, and they do have outbreak strike teams. They just may not have people that are specifically identified for schools. So next slide, tools created for schools. So just to give you an idea, What we have created locally and provided our schools is local outbreak guidance, environmental health checklists for sanitation and disinfection, the line list that we use for reporting disease and symptom checking, symptom reporting, and then our Washington County intake form, because they can help speed things up if they have the staff and resources to help with those intakes right away, so if there's a new case. And then contact and resource document, which just really lists all of our staff that are primary contacts for different portions. And then testing site documents. And all of those were released with some of our state organizations. So the Oregon School Nurses Association, they have a communicable disease protocol. And so we released it with that information, and the same with the CDC sanitation and disinfection guidelines. So releasing sort of a local version that goes along with these statewide broader versions. Okay. So then you might wonder, well, what are we doing? Because we're also an employer who has a staff that has students and childcare needs. And so this week, and I think you all probably receive, when there's an all-staff email or all-staff survey, you all, yeah, you're shaking your heads. So we have sent out an all-staff survey to really help us to understand the impacts and the needs. We're also reviewing data, so we're looking at the school systems and what they're offering, looking at childcare capacity, and then the survey results. And just Eva's group has done a great job of kind of brainstorming. Eva Labonte in HR has done a great job with her staff of brainstorming what are some potential options and policies to consider. And Sia is leading a cross-county work group that includes representation from the Sheriff's Office, from Juvenile, HHS, and CAO and HR, so that we can just really consider what are some of the human resources policies that we need to think about to support our families and staff.
Is there some cross-fertilization with CWS along these lines too?
Yes, we can coordinate sort of what we're doing and.
Yeah.
Great.
We were aware of their survey, and I think as we start looking at options, there's definitely thoughts about we need to connect and make sure we're collaborating. So, all right, and then that's it. That is a deep dive. Not sure if you have questions or comments.
I have a general comment, and this is only for my intellectual curiosity, probably nobody else's, but there's always a fine line between giving out too much information and not enough. And I've always appreciated personally your updates in terms of understanding, but my experience on the transportation side tells me that if you put flashing signs or you put things out that warn people, after a while they ignore them. And I have heard comments from the public that there's too much, and so it's always curious to me what's too much and what's too little. And I don't expect us to have any dialogue or discussion right now, but when do people start ignoring, saying, you've overloaded me, I don't know anybody who's sick, I don't know anybody that's got this, so I'm not even going to believe it, to understanding that's very real and very serious for some people. So it's a fine line. I don't know the answer to that, and I'm not asking you to give me an answer because you don't know either, but at what point, if people throw their cares away and say, I'm going to aggregate with 100 of my friends down at some beach or some other place they recreate, and say, I've heard too much.
We are sure struggling with that. You're right. We're really struggling with that, and we have really smart communication staff at all levels here at the county, regionally at the state, and I think everybody's struggling with that. My husband teases me and says, you've completely lost control of the public. So, and I say, you're right.
You never had it.
That's exactly right.
You never had it.
Yeah.
Any other questions or comments, commissioners? Well, thank you very much, Marnie. Really appreciate the clarity in understanding how our school districts are proceeding and what our role is, as well as the support that you and your team are able to provide. So thank you very much.
Thank you. I'll see you back at 10.
Okay, thank you. We'll move on to our last topic for today's work session, and that is the Washington County Audit Committee member recruitment. And this is with regard to financial audits versus program audits, which our independently elected auditor takes care of.
Thank you. Good morning, Chair Harrington. Good morning, Commissioners. I am in front of you to present an overview of the Audit Committee member recruitment. And as the county continue to respond to the ongoing pandemic, our regular operations has not missed a beat. And the audit work in the county is actually one of the examples that has been ongoing. We're well into our audit season for the fiscal year 2019-20, and then our financial reporting team has been working closely with our auditors on the audit. The audit committee itself is to provide oversight and review of the county's audit process as well as the audit result that actually assures the county's accountability when it comes to the financial reporting. And we currently have 2 vacancies on the audit committee, and we received 4 applicants and have interviewed 3 of the 4. The last one, Alan Rose, did not respond in time when we requested for interviews. So out of the 3 candidates that staff interviewed, 2 really stood out, and the 2 that we are recommending is Anastasia Milliman, who is a new applicant for the audit committee, and she came from engineering and financial background with a well-rounded knowledge in financial reporting, and also she showed great passion and excitement in being a part and participating on this board and commission. And the other one we recommend is a reapplication from Eric Moss, who was a previous chair and then previously a regular member, and he has institutional knowledge of the county's financial audit in the past few years, being a member since 2011, and we feel that retaining some institutional knowledge on the audit committee would serve the newer members well to kind of add in that diversity there. So that's our recommendation, and I'd be happy to answer any of your questions.
Just a comment, Jack. I know how difficult that committee is to staff, and I certainly appreciate people coming forward, but what we used to do once upon a time is we'd actually go out and recruit, because this is such an unusual committee. You have to have really a good understanding of GASB, you have to have a good understanding of principles of auditing, because it's not just that you're not managing any public money, you're managing the process, and you have to really have a good understanding of the technicalities of that. No comment on the people involved. There was no one who submitted an application who had been through a CAFR process where maybe they had either prepared it, or an auditor out there who had performed these kinds of activities who would have expertise.
So out of the applicants this round, we did not see any of that specific public sector experience, and we always look out for adequate financial experience that actually can translate into an audit kind of setting. I know that Eric Moss has a lot of private sector experience, from a CFO finance director's role. And Anastasia, while has a little bit less experience in terms of that, but she definitely showed adequate understanding of the general process of audit.
Eric worked for me a long time ago, so he has this kind of experience as well. But one of the things that you might consider in the future is advertising with the OS. Are you an OSCPA member?
I'm not currently a member
That's okay.
of OSCPA.
Go ahead and advertise with them when they're governmental committees. They have lots of accountants who do that specific work. It's just unusual. You like people that participate who have backgrounds, in all kinds of different things. But in this particular one, I mean, you're managing an audit process, and so you really have to understand it. But anyway, just for the future, you might want to go to the OSCPA. They have a governmental section, and
Yeah.
we've got lots of people who live right here in Washington County who probably, if they knew there was an opening, they would apply.
We'll keep that in mind. Yep.
Other commissioner comments? I was really struck, even though I've been on this committee now for, well, this will be the second year, how small the audit committee is compared to, say, the Metro Audit Committee. And a couple of positions can make a big difference. So I was wondering what it might take for us to expand the committee by one or two people. Are we bound to limit it to 4?
I'm not aware of any external guidance that limits the number of the audit committee. I believe it's a board direction on that.
Well, I was wondering, given that Darlene Dick, according to my read of the application, had some finance experience, or in terms of continuing to advertise for some additional formal audit experience, if we might consider that as an option.
My comment would be that the committee's too small. And the reason it's too small, we've had issues in the past of trying to get quorums. I don't know how it is now, because I haven't served on it last year, but expanding would make sense, and getting some real technical experience is always helpful. So I don't see why it'd hurt to add 2 or 3 or 4. It's a small committee, very, very small.
So you've been on this committee for years before. Why didn't you expand it then?
The reason we were pretty set on having a lot of very specific experience in auditing, because we understood it was a very technical committee. And no one ever brought it up, frankly. Didn't even think about it.
Well,
Yeah.
I was on the Metro Audit Committee, and having people who are interested in finance but not needing to be conversant in the ins and outs of particular GASB rules was not at all detrimental to the effectiveness of the audit committee, and actually provided for some, I think, better understanding and evangelization of the work that goes into the financial management of the public assets. So I think it would be a good time for us to expand the committee. But in the meantime,
I would agree.
let's make sure we move forward with these 2 particular appointments. And then, as you and your staff are able, let's look at expanding that as well. Any comments from our CAO?
I just think it probably will take a change to the bylaws. So we'll bring that forward, and then we can move with that.
Yeah, I think we want to make sure we have a minimum of 4. And I did go back and actually look at the bylaws, but I wanted to consciously ask about if there was anything that would prevent us or any other hurdles. So, okay.
Thank you. Just for clarifications, are we looking to expand seat during this audit season, or are we thinking of in the next audit season?
Well, I think some of it goes to the amount of work. That's why I was turning to the CAO to take it as something our goal is to try to achieve that, but I think the timing needs to be definitely taken into account and manage the full plate, which is not for us as a board, I think, to decide per se. We don't have enough information right now to weigh in on that, is a better way of putting it.
Yeah, we'll review it and come back to you on that.
Okay, thank you. We'll come back in 2 weeks with these 2 applications that we recommend, and then we will discuss internally on the possibilities of expanding seat.
Great.
Thank you for your time today.
Thank you. All right, that's it for today's work session agenda. Any last items before we adjourn today's work session? All righty. Well, we will reconvene in our business meeting at 10 o'clock.
Remember your old Walton days. You remember that? School was up there. Bridgeport Elementary. Yeah, you're absolutely right.
For a second, I thought you were saying Fox Hill, and that was one of my elementary